But the problem is when I sit down, like for 1 hour, and then stand up,
Okay.
the pain is there.
So rest your hands here. I'm going to talk while I'm doing this, okay?
Okay.
All right, so I had a walk-in today. Usually we don't have a lot of walk-ins. People usually
Okay.
schedule, but welcome to the practice.
Okay.
Edwin came in today complaining of lower back pain that's been very chronic for how many years?
Like 7 years.
7 years. And you had chiropractic care before.
Yes.
And as you can tell, he's in really good shape. So he's a trainer, he works out, but he basically says anytime he goes from sitting to standing, he feels it in his back. So we did an evaluation, looked at his posture. He's not the worst I've seen. You see people come in really bad shape. You're not the worst I've seen. So you're gonna get really fast results. So slide down towards your feet. But one of the things that we did find is when we looked at his posture, because we always start by looking at the posture, is that his head was translated forward almost an inch. So instead of his head weighing 15 pounds, his head's weighing 30. So the effect of gravity places on the spine causes a lot of pain and a lot of dysfunction. So we're going to start with the ring dinger, which is going to help completely unload the entire spine. Take a nice deep breath in and all the way out. Good, Edwin. All right. So your fingers are going to stay locked like this. You're going to breathe in and out through the nose. Okay? Keep the mouth closed. And when I say wiggle the toes, I'm going to have you wiggle your toes. Okay? I'm going to raise this up a little bit more. And for the viewers out there wondering why I keep on messing with that, I'm trying to get his feet parallel with the table. So when I do the pull, it should go all the way down to that lumbar spine, which is that area that's really compressed right now. And then I'm going to adjust the rest of your spine as well. But being that this is your first visit here with us, I like to start with this. Okay, breathe in. And out. Good. Breathe in. And out. Wiggle your toes. Wiggle them.
Yeah, I feel it.
Stay right there. Where'd you feel that?
Right there, all the way in the back.
Right in the lower back.
Yeah.
Okay. So that was good. Stay right there. Always, we're going to adjust the entire spine. So stay right there. Take a nice deep breath in. Very easily. Cervical. 2, 3. Drop this. Got it. Clean. Drop this. And get a little more into it. Even better. Stay right there. Good. Stay right there. All right. And when we did the leg check, he felt a lot of pressure on his lower back. And as you can see, he's in great shape. I have people coming in really bad shape, like the last guy that came in, really, really bad shape. But when people are in good shape like this, they bounce back real quick. All right, so turn your whole body facing me. Turn your whole body, and then push yourself up to a seating position. Okay. Stand up. What's different?
Yeah, I feel more relief.
Less pressure.
Yeah, I feel more. Yeah.
Okay.
Yeah.
Let's go face down. So, for the viewers out there, what we are doing is we're unloading the discs, we're unloading the entire spine, so it does have an effect from the cervical spine all the way down to the lower lumbar spine. And yes, it's safe to do if you have bulging and herniated discs. In fact, those are the people that you want to come in and have multiple herniated discs. What is medicine doing, right? They're giving you shots, they're giving you pills. All right, now when I do this, is there less pressure in the lower back?
Yeah.
That's a hell of a lot better.
Yeah.
A lot better. So we're still going to adjust the entire spine using the drop technique. Good. And using the drop technique is a manual drop. I can control the amount of drop I get in there. So yeah, he actually walked into our office in Manhattan because he's been following us on Instagram, of all places, and he decided, let me give it a try. Good. Breathe in. Drop this. Bend your knees. Bend your knees. Drop. There we go. Put them down. And again, you can see, man, I'm putting a lot of force into the spine here, making changes. Easy, easy. Yeah, no problem. Immobilizing that. Drop this. Good. Flip over, lay on your back. So you tell me how you feel when you get up. Good. And we're going to do, drop this. Drop this. Good. Hold this leg up for me. Don't let me push it down. Okay, good. Put it down. Bring this leg up for me. Hold it, don't let me push down. Okay, pretty strong there. All right, stay right there. Swing your body around. Stand up again and tell me what's different.
Yeah, I feel more light.
More light.
Yeah.
Try sitting to standing. Because when you came in, that's the first thing you said, you had difficulty from sitting to standing.
Yeah, I feel much better.
Much better.
Yeah.
So like I said, he's a great example of a healthy, fit guy that's going to bounce back super quick, where you have other people come in and they're messed up for like 10 years. You know, they're not going to get the results right away, but he's going to get results right away. I'm going to do some instrument work with you, okay? All right. Okay, stay right there. Right, so I'm just going to get into that lumbar spine using the instruments. So is it worth the trip out here to get adjusted?
Yeah.
Okay, so today is Thursday. I'll be back in the office on Tuesday next week. We like to keep the visits close together. We don't want to see people a whole bunch of times. We only want to see them 6 times, release them from care, and then they come in for wellness or maintenance, okay? A lot of my patients come in when they feel like they need to get adjusted. Some people get on a schedule when they're like, hey, I'll see you every month. Some people come every 2 weeks. We don't always have to do the ring dinger, but in the beginning, it's a great way to completely change what's going on. So we have people from every walk of life looking for results. All right, walk around a little bit. And what percentage better would you say you are from when you walked in?
Can't say right now, like 80%.
80, okay, good. So I got 2 80% in a row. I'm usually happy with 50% improvement after one visit, but if you're saying 80, that means I did my job. You're happy?
Yes.
If you're happy, I'm happy?
Yeah.
That's awesome.
Yeah.
So today was an interesting case. We had a patient walk in. We usually have patients call on schedule, but we had a walk in. So this patient's been following me on Instagram for a little while now, and he's been seeing my Instagram videos of me doing the ring dinger. So he just said, hey, I'm in pain right now. Let me pop in. I just so happened to have an opening. We brought him in. As you can tell, he's super fit. He lost over 100 pounds in the last couple of years. Super fit, but he's still dealing with chronic lower back pain that he said was bugging him for years. And we did an intake, we looked at his posture, we did some range of motion, some orthopedic tests. Super easy case. I'm usually dealing with people that are really messed up, multiple disc herniations, have tried numerous issues with no results. I mean, one visit, the guy was 80% better, and you could see it if you're watching this video, how much improved he was, where he went from having difficulty sitting to being like, hey, I'm ready to go back. So this is quite typical of the results that we see when we pick the right patients. So if you're watching this video out there and you're like, hey, let me give it a try, we don't ask for patients to be here 20, 30 times, which is typical with a lot of chiropractic offices. We usually give them about 6 visits in a very short period of time. And if we can help them, we're not going to keep on trying. You know, we're going to recommend them to the more appropriate treatment for them. But when you address this physical structure, people feel better right away. So if you're watching this video and you have doubts, email us, send a message, call us. We'll be happy to talk to you. But this treatment is a game changer. So dealing with back and neck pain, sciatica, arm pain, and you're looking for a solution and you're in the New York metropolitan area, give us a buzz. So a lot of these videos you see, we're doing the ring dinger, which is something that we do, but it's not the only thing we do here. We also have other modalities like cold laser therapy, spinal decompression, shockwave therapy, Graston technique. We do all these things to get the patient better without using drugs, without using surgery. And yes, the ring dinger has been a game changer for the practice. It makes up a large portion of what we do, but there's a lot of other modalities that we incorporate with it that really bring our practice to the next level.